I really reflected on that and thought, well, how can people get more out of psychological treatment? Because, get around some of these barriers to those traditional 50-minute sessions with a psychologist, which are incredibly taxing and draining.
Fellow Homo sapiens. So, people with epilepsy are at a far greater risk of having poor mental health than those without. But that is why I am delighted to tell you about this week's Epilepsy Sparks Insights episode with clinical psychologist and senior research fellow Milena Gandy from Macquarie University in Sydney. Milena shares with us her cool self-management online program called the Wellbeing Course, which has already had a fantastic impact upon so many people in Australia.
Yeah, my name's Milena Gandy. I'm a clinical psychologist and senior research fellow here at Macquarie University at Sydney, Australia. And my work really focuses on helping people with epilepsy manage their mental health and psychological well-being.
Bro, we need more people like you. And so how did you get into it? Why did you decide to focus on this topics?
It really came about during my training as a clinical psychologist. So there was kind of a local epilepsy hospital nearby that was treating lots of people with epilepsy that also were experiencing depression. And they approached the psychology clinic to say, look, is there something you can do to help? So I built my PhD around that clinical need. And that's how I got into working with people with epilepsy. And I also have a few family members with epilepsy, so I was super keen to get involved. And I've always loved clinical health psychology.
Tell us a bit about it, about your design and implementation and everything.
Some of my original work was trying to run, for my PhD, was running treatments kind of face-to-face with people with epilepsy. So I ran a randomized controlled trial of cognitive behavioral therapy. And I found, it had some benefits and it went reasonably well. But there were also a lot of kind of like practical barriers. So, because people had to attend a psychology clinic to receive the treatment, that didn't always happen. Often people had seizures and that impacted things, or they couldn't get there on the day because, of travel restrictions. They might not have had a driver's license and, public transport. And I also found, cognitive difficulties tended to predict people that dropped out. And that I really reflected on that and thought, well, how can people get more out of psychological treatment? Because, get around some of these barriers to those traditional 50-minute sessions with a psychologist, which are incredibly taxing and draining. They require a lot of memory and attentional demand. So that has really motivated my recent work. So I've kind of moved to being, I guess, what some people call a virtual psychologist, and a lot of this work started before COVID, but now we're kind of seeing the appeal because, of COVID. I've started to work on digital psychological treatments. And I joined a team at Macquarie University called the eCentre Clinic that specialise in evaluating and developing remote kind of digital psychological treatments for common mental health difficulties like depression, anxiety, and for chronic health conditions like chronic pain. And my work now at Macquarie Uni has been developing a course for people with epilepsy and other neurological disorders. And this is a completely remote digital psychological treatment called the Wellbeing Neuro Course. And it's been going really well so far.
What's been sort of like the feedback on the course from patients and fellow clinicians and stuff? And what have been the results, if you've been able to measure those so far?
Firstly, I think patients have really appreciated the digital approach, it being a lot more flexible, particularly now since COVID. And the course, it focuses on not just kind of the mental health side of things. So it provides lots of skills and strategies for managing depression and anxiety, some of that traditional kind of cognitive behavioral therapy, but it also integrates more compensatory cognitive rehabilitation skills. So it also focuses on managing day-to-day activities and cognitive problems. And traditionally, these kinds of treatment tend to be offered in isolation. So a lot of participants in the course have valued getting that information together. And as a psychologist, we support people through the course through phone calls and through kind of therapeutic messaging. But all the main materials are online through kind of online lessons. They're a little bit like PowerPoint slides, but a bit more fancy than that. That people kind of work through them in their own time, at their own pace. They can read and revise the materials as many times as they need. They can print them out. They can share them with support people. So that kind of flexible model has been beneficial for lots of people and can get around some of those cognitive difficulties of that traditional kind of 50-minute session with a psychologist. And to answer your question about clinicians, they've been finding this kind of work really helpful as well, to be able to work with people that are really geographically spread out. So we've been able to treat people across Australia and larger numbers of people than we could do face to face. So yeah, it's been found to be quite acceptable, and from kind of a research lens, I've now run a phase 1 trial that's published, and I've just finished a phase 2 randomized controlled trial, which is soon to be published, and they support these findings. So the course has been found to be highly acceptable. There's high rates of completion and low dropout rates. More importantly, it's led to kind of, clinically significant improvements in symptoms of depression, symptoms of anxiety, and day-to-day disability. And I've also seen shifts in symptoms of anger and frustration and just perceived cognitive difficulties. That's really been encouraging.
That sounds great. So have you also had involved First Nations Australians? So people like you saying, sort of who are often in more remote areas who can benefit from this, and often sometimes culturally or for whatever reason might, find it more challenging to work with somebody in the more traditional sense, Western traditional sense.
That's a really good question. There have been some people that I identify as Indigenous go through the course. I'm also affiliated with a service called the Mind Spot Clinic here at Macquarie University, and they're a national service that's kind of taken a lot of the courses that we've developed at the eCentre Clinic, at the research side, and implemented them as kind of a national service through digital health. And they've got specialist courses and clinicians that support Indigenous Australians. So yeah, it's been nice to see that be a part of that translational pipeline and tailor our courses for, like you said, kind of populations of people that can often not always access psychological treatments or can benefit from things that are a bit more tailored.
You mentioned anxiety and depression. Do your courses positively impact people who experience other types of psychological issues, or is it solely the depression and anxiety at the moment?
That's what I've been focusing on at the moment, the kind of common mental health difficulties, but also, like I mentioned, trying to also weave in some skills and strategies for managing frustration and anger, which tend to be a little bit neglected by mental health professionals, but a lot of people with epilepsy and other neurological disorders have told me they can really struggle with those symptoms.
Which is making me think that if you're helping people to deal with these, the thoughts that they're having about themselves, actually that benefits people who have other psychological issues. So they might not have diagnosed depression, anxiety, but actually their feelings of awfulness are often closely associated with other psychological issues, right? So it's like it would indirectly benefit other people too, I think.
Yeah, and I've taken the approach, because it's a trans-diagnostic kind of approach where I'm targeting multiple outcomes and broad kind of outcomes of disability. I haven't been strict in saying you need to have this level of depression and this level of anxiety to take part of my treatment. It's been more like, would you like help with your mental health? This is what the course is about. It's kind of got a self-management focus. Would you like to take part? So that gets around some of the limits of just kind of, having those strict criteria. We can look at that in the research and kind of filter for people with clinical symptoms or not when we look at the outcomes. But I've tried to be inclusive, because, like you said, there might be other types of psychological challenges people are facing, and what they what they're hoping to get is kind of skills to manage day to day and to self-manage mood. And that is the focus it takes. And yeah, kind of having that broader scope.
And what have you gotten out of this personally and as a professional? Like, you know, what has this brought you, having this such a successful project that helps so many people?
It's been wonderful to work with people across the country. I've also, my main focus has been in epilepsy, but I've also been working with people with lots of other neurological disorders that I find have very similar challenges to well-being and mental health. So people with MS, Parkinson's, brain injury. So that's really benefited me. I've enjoyed learning from people with lots of different neurological disorders and trying to take that knowledge and see how it can improve the epilepsy field and vice versa. That really excites me. Just having something that's highly accessible, that's gets around those barriers. Psychological care can be very expensive, and it can be really challenging to find people in the community that specialize in neurological disorders, particularly clinical psychologists. So I've also really valued being able to fill that gap, I guess. And it's not to say it's for everyone or it's going to replace face-to-face treatment. It's not a panacea. It's not a one-size-fits-all, but it's been nice to see that many people have benefited, and it can kind of form part of what I hope will be lots of different options for people to get mental health support.
And what are next steps in this whole, I don't think it's even fair really to call it a project, because it almost seems like changing the world type thing. What are you going to be doing next with all of this work?
Great question. So I'm really keen to continue the research pipeline of making sure it is effective, it's the best kind of product it can be, get lots of consumer feedback of how we can improve the course. It's not perfect, it's still kind of developing, but ultimately look at how we can implement it within health settings and integrate it within neurological care. That's kind of a passion of mine. I don't want to do research for research's sake. I want it to improve health outcomes and, be an option that's kind of sustainable and scalable through services. So that's what's next, looking at ways to best do that. And it also fits in with another hat that I have with the ILAE, working as part of the Psychiatry Commission. So I'm co-chairing a new task force that just started this year, and that's called the Integrated Mental Health Care Pathways Task Force. And it's a big name, but it matches this. It's really, our vision is to see how we can integrate mental health care more within epilepsy care.
Thank you. And it's absolutely crucial. I've said sorry everyone listening who listens regularly, I've said on so many episodes, many of us would rather have more seizures or have a seizure every day, if we're lucky, if not already, than feel awfully depressed and like life is not worth living. So yeah, both things have to be managed at the same time, I think. Well, thanks so much. It's been fabulous having you here, and we hope to meet you again soon.
Thanks
Cheers.
so much for having me, and the podcast is wonderful.
Thank you so much to Milena for telling us about her exciting work, seeing things from the patient's perspective and improving our lives. To learn more about Milena, make sure that you check her out at torierobinson.com/epilepsy-sparks-insights, where you can find out more about her and links to her work. If you enjoyed the episode, please do share it with your friends, family and colleagues, because it really helps us to get our messages about the epilepsies out to the masses. Make sure that you check out our cool Epilepsy Sparks merch, t-shirts, mugs, notepads, etc. at epilepsysparks.com.